I'm Tom Phipps. I was the first person chosen to take part in the second GDNF trial as a treatment for Parkinson's. I went to a lecture with Alan Woner, the consultant in Bristol, and he convinced me in his preamble that GDNF is the drug to use to improve the state of people with Parkinson's. It is a drug that introduces neurotrophic factor to rebuild the neurons that I'm missing in my brain. I offered my name forward, and within a month I was taken in, assessed, and then offered the chance on the 5th of November 2012 to take part in the trial. My first operation was 12 hours long, and the rest is history.
So we identify a target in the brain, we deliver guide tubes along preformed tracks to precise locations, then we deliver the cannulas down through the guide tubes to deliver therapy, either a single shot through acute delivery, but also we can tunnel these devices under the scalp and connect them to a really novel bone-anchored transcutaneous port. So that then facilitates repeated awake delivery, so patients can get infusions while they're awake. They can come to day case surgeries and just be connected and have an infusion. So basically, in its basic form, it's a catheter system to deliver drugs deep into the brain on a repeated long-term basis.
Well, the port I've found is that it hasn't been a problem. It scared the barber when I first had it fitted. He wondered what that thing was stuck on the side of my head. My son takes great delight in tapping a beer glass against it when we're in the pub. I wash it every time I get my hair done. I use a medicated shampoo, and that seems to do the job. Keep an eye on the growth around the outside of the port, and make sure it doesn't get too thick and dry skin builds up. I clean that off, but that's all I do. I was a bit concerned that it was going to cause a problem with infections, but I haven't had an infection. No problem at all really with it. I cycled over to the infusion, locked the bike up and sat in the chair for about an hour or so. Had the chance to do a puzzle in the Guardian. There's no sensation when you have you're just aware that there is something plugged into your scalp. And the infusion itself was fairly trauma-free. I wasn't really aware of what my role was in the global aspect, but having looked at it in retrospect, I think I'm really pleased that I was able to do it.
It was quite clear that we did have a device could be used for oncology indications, specifically in children with brainstem tumours, and on humanitarian grounds we've done, I think, close to 23 patients using the system, which has been very successful in its use, and in GBM patients as well, such that we now have active programs in developing the system for neuro-oncology as well as neurodegenerative diseases.
I got a lot out of it. I think it made a big difference to me for a few years, and I wasn't dwindling. My powers of recovery were helpful, but I haven't developed Parkinson's as quickly as some people have, because I was diagnosed in 2005, which means that now I'm in Parkinson's for nearly 20 years. Normally people would be worse than I would after 10 years. It's the honeymoon period is about 10 years with Parkinson's. So I think that the drug infusion I had has delayed the onset of Parkinson's in its more aggressive form. And I think I feel privileged by having done that. I've also dined out on it quite a lot because it's been very useful for talks to say something innovating to people and gives hope to people with Parkinson's that there is a cure around the corner.